Okay, now let's talk about the skull and the different bones. So you could get out your little handout here and maybe print it out if you'd like, and then we'll go over the bones. First thing, though, that I want to do is talk about the human bones. Just it helps me as a human physician to orient to what we're seeing here. And looks a little bit like Halloween, I guess. But anyway, so I mean, it's just notable how different their skull is, the dog skull is than ours. So this is the frontal bone here, and then we have the little nasal bones there in the light brown. The maxilla is in this blue green. But also notice how the frontal bone, it comes into the orbit in here. And this orange is the zygomatic bone, and that also forms part of the orbit. The red here is the sphenoid bone, and we can see a lot of that in the underside because it's just right in the middle of the head there. It has a bat-like structure. Very, very, very critical in a lot of ways, and it houses the pituitary gland and such. In the yellow here, we have the little lacrimal bone right in there. And then in brown, we have the temporal bone. And I'm holding this carefully because this is a disarticulatable skull or skeleton piece skull for osteopathic considerations. So, and it's magnetic, so I can actually take the mandible off here and it would reattach. So I think I will do that. But anyway, we have the brown temporal bone. We have a squamous part and a petrous part. The petrous part has all kind of the good stuff in it, including that little styloid process and the stylomastoid foramen. So here's the mastoid bone, and here's the styloid bone. So what's between there? The stylomastoid foramen, where the facial nerve comes out, the motor branch, the muscles of facial expression, and triple heater 17 is associated with that point. So we'll go through the points again in a bit. And other interesting things, let's say the palatal bone, and I think that's mainly there. But and then also the green, very extensive parietal bones here. And I just want you to know, if you've ever heard of craniosacral work with from an osteopathic technique that was extrapolated to the non-human, note the interdigitating sutures there, and this suggests the capacity for movement. That's part of the craniosacral treatment thing, and the mobility of the cranial bones and all that. But I dispute that there is a easy translation from the human craniosacral concepts to the non-human, even though you got all these people teaching it, that we don't have the fundamental structural components that would suggest that there is as much or any cranial bone mobility or motility in the non-human, or at least we should question it. We'll get back to that. But anyway, so here's the parietal bones, and then here's the occiput. Very extensive occiput. We have the foramen magnum right here, and that's for the spinal cord, a little bit of the brainstem. We have an external occipital line here, and no ridge for locating GV20. So we will differentiate that with the dog. All right, he'll have his mandible back. Okay. Now with the dog, I'm just going to, you can get your own paper out. But what we see here, for one thing, this is a actual dog skeleton. It's kind of decalcifying as we move it around. But the sutures are not still there. It's like the sutures are ossified. And what's more is on this ridge, we have this interparietal bone, and that's spanning the midline. So if we have to, for craniosacral work, think about all the different bones having a slight amount of mobility and work in a gear-like fashion. I won't go into it now, but the fact that we can't even find sutures that are still looking open in the cranium, we have to question whether that extrapolation from human osteopathic manipulation actually is valid. What's more is that when we come down on the top here, these sutures, these are not interdigitating. There's this one, this is just pure bone right here. But even coming down on the nasal bone here, and the incisive bone here, and the maxilla, I mean, these, some of them have some interdigitations, but a lot not. But so let's let that go. Just to review the bones, this is the temporal bone in through here, and might be helpful for you to see the thing as well. But this is the squamous part of the temporal bone. This is the parietal bone, which is here in blue. This is the interparietal bone here. It spans both sides. But back to the temporal bone, which is here in green, we have a flat part, the squamous part, and then the petrous part, again, that has the tympanic bulla and styloid process, paracondylar processes, and a stylomastoid foramen, and other good stuff, even going further out through here, where cranial nerves are emanating from. But back to this, we have a little bit of a broken part on the temporal bone here that would be a zygomatic process. Then we have the zygomatic bone here in red, that actually, interestingly, would still participate just a teeny bit in the orbit. And like with the human, it's more, and we have that complete bony orbit. And then a lacrimal bone here, and then the frontal bone still continues, as you see here in orange, down into the orbit. But the maxilla, as we know, is extensive, and then, of course, the mandible and through here. Okay, I think that's all of it. But if we want to then talk about the acupuncture points, just to review. Okay, so acupuncture points that we'll be talking about will be, let's see, let's start with, so GV20 at the rostral end of the sagittal crest here, and then GV24.5 between the eyebrows. I'm going to use my finger because I'd rather be palpating it. So the putative eyebrows, GV24.5. GV26 right there between the philtrum and the skin there. And okay, so just so I'm working medially to laterally. And these aren't all the points in the human, but they are from the big points list. Now, if we also want to include bladder 1, that would be just dorsal to the medial canthus at the eye. So I'm just trying to show you the bony relationships right now. All right. So governor vessel 20, governor vessel 24.5, governor vessel 26. If we want, we could talk about large intestine 20 on either side here. And then bladder 1, just dorsal to the medial canthus of the eye. Bladder 2, just above that along the orbital rim. In the human, we have that supraorbital foramen. And the dog does not. You can find that towards the medial end of your eyebrow. In there. But they just have a hole. And okay, if we even just want to go around the eye, then we could say we have bladder 1, bladder 2, and triple heater 23, and gallbladder 1. And then we could also talk about stomach 2 at that infraorbital foramen right in there. So the neck will be a separate part, but bladder 10 will be just caudal to the most cranial part of the wings of the atlas. If we talked about stomach 2, And then stomach 4, we'd have to see where the lips are and the angle of the mouth. That would probably be a little bit lower because that's where the lips come together, that labial commissure of the mouth. So stomach 4, and then stomach 6 will be in the center of that masseteric fossa. If we had ears, then we could talk about the 3 near the ears, but we don't have the ears, but it'd be triple heat of 21, small intestine 19, and then gallbladder 2 at the ears. We're not right there right now. I think that is it. And if there's more, we will be covering them, but just a quick reminder about where the acupuncture points are on the skull. We'll give this guy back his mandible. Thank you. Thank you.